A new vaccine for malaria developed by Oxford University is being hailed as a breakthrough that could save millions of lives. It's the second malaria vaccine to be developed, but crucially, it's considerably cheaper and will be produced on a massive scale with up to 100 million doses a year. That should vastly reduce the toll of a disease that claims hundreds of thousands of lives every year, almost all of them children in Africa. Our medical editor, Fergus Walsh, is here with all the details. Fergus.
Thanks, Sophie. Well, malaria has been causing untold human suffering for millennia. The parasitic infection is spread by mosquitoes. Africa is worst affected, particularly the areas marked in red here, which account for 95% of the global burden of malaria. In 2021, there were an estimated 234 million cases and 593,000 deaths from malaria in Africa. Most of those were children under the age of 5. The Oxford vaccine is called R21 and requires children to have 4 doses. Trials run by Oxford's Jenner Institute show it's around 75% effective at preventing malaria. Crucially, the world's biggest vaccine manufacturer, the Serum Institute in India, has agreed to produce 100 million doses a year of the Oxford jab at between $2 and $4 a dose. This will be Africa's second malaria vaccine. The first, RTSS from pharma giant GSK, costs about twice as much. Since 2019, just 1.7 million doses have been administered. So the new Oxford vaccine could be delivered at a much bigger scale.
Today is a great day for health, a great day for science, and a great day for vaccines. As a malaria researcher, I used to dream of the day when we would have a safe and effective vaccine against malaria. Now we have 2.
Today's announcement follows a major trial of the Oxford vaccine involving nearly 5,000 children across 4 African countries, lasting several years. Our correspondent Anne Soy witnessed some of the children getting booster doses in Tanzania and has this report.
A life-saving jab, giving protection against one of the biggest killers of African children, malaria. It has taken decades to find. 3-year-old Hajra was one of hundreds of volunteers in the clinical trials. Her mother, 39-year-old Mwazani Saif, had a compelling reason to enroll the youngest of her 6 children in the study.
I lost my nephew. He was only 4 when he died from malaria. That's why when I heard that there was a malaria vaccine trial, I said I wanted to participate because it will help us.
Here in Bagamoyo, 600 children took part in the trial. Experts are urging people to continue using the proven methods of preventing infection, even with the discovery of a new vaccine. The results of the final phase of the research surpassed expectations.
What we've shown in 1 year after the 3 doses, the efficacy is about 75%. Again, well above the goal set by the WHO and malaria community. And this is really exciting.
The job is far from done. The vaccine now needs to be delivered to villages and towns across Africa. For families like Mwanzani's, it will bring them much-needed relief from disease and keep her children alive. Anne Soy, BBC News, Bagamoyo.
The next step is ensuring there are enough healthcare workers across Africa to administer these jabs to the children who need them. And it's worth remembering the vaccines are not a magic bullet. Other malaria control measures like bed nets will remain vital. Sophie.
Thank you.